So, Nathan, we kind of touched on it in the earlier segments here today, but we wanted to talk about the idea of ongoing assessment for individuals who are working on the front lines, specifically front lines of healthcare. But the idea of how much trauma are we accruing in our trauma bank because of our job? And is anyone asking the question of how are you really doing? More than a manager walking by on your unit and asking it, or someone checking in with you, but a professional who knows what to look for. What if someone was checking in 4 times a year with what your experiences have been, how you're managing with them, how you're coping with the stress? What is your mental health actually like? Not at a time of crisis, but as a maintenance check-in.
Yeah, that's something I've thought about for quite a while. Is anybody who's a first responder, anybody who's in acute care, ER, and I think probably everybody else as well, maybe to a lesser extent as far as frequency of assessment is concerned, but first of all, Corey, I'll ask what I know nurses are supposed to do some kind of a debriefing. What does, to your knowledge, what does that look like in the average health authority in BC? Is that something that takes place once a month? Is it once a year? Is it as needed? And how does it work?
So, to my knowledge, the debriefing process happens immediately or as close to the event occurring. Oftentimes, at least in healthcare, it's physician-led or leadership-led, where the incident is kind of broken down blow by blow of what happened and who did what worked well, what didn't work well, if there were any unresolved thoughts about anything that occurred during that incident, things that people want to ask or want to talk about. So it's very much sort of like a roundtable discussion, but it's usually led by the team of physicians. And that is, again, so if there was a trauma that came in, that would occur, within an hour or two after that incident. Sometimes it's right away in the trauma room, but sometimes it's because if other things are going on, it takes a little bit of time. I've also been involved in incidents that where it was come in the next day, and we'll bring in a professional like a psychologist to lead the debrief. And those are usually for a little bit bigger incidents that have happened, but yeah.
Okay. So there is some acknowledgement and there is some action taken as far as they realize that some of these events are going to impact people. There is going to be trauma. What are your thoughts on that process as far as its effectiveness? Is it working? Is it helping? Is there things that we could build on from there? What do you think?
I think it is a good thing. Certainly it's good if you have any little hiccups during the incident that where people can air that out and ask the question about why did we do this or why didn't we do this, say. Does it take that away? Does it take the memory of the trauma away? Does it take the full impact in the brain away? I don't think so. I think that at times it can give a little bit of clarity and maybe a little bit of closure even. Mm-hmm. But sometimes it takes longer, I think. I think that the impact can be lingering, and the impact that question needs to be asked maybe again down the road about how are you doing after this incident. It ties it up. There's some closure there, but it's not necessarily internal closure for the person on the receiving end of it. I don't think.
Right. Yeah. So that's closure was what I was thinking when you were discussing that yeah, maybe it did kind of tie up some loose ends, but is it set up to identify particular individuals who may have been affected in a significant way?
That's another good question. I in the debriefs that I've been a part of in the past, it would be the whole team involved. I think there's sometimes benefit to further conversations one-on-one, or conversations just with the individuals who were more directly impacted or had a more direct role.
Mm-hmm.
I've been in debriefs that have been too big, too large of a group, where you feel like you're lost in that a little bit, or where you need a little bit more time to talk it out and bang it out. And we're with too large of a group, and especially with a group of your peers, depending on the group of peers, it may not feel safe.
This is the problem that I see with that, like what you're discussing there, because it's not one-on-one with a trauma professional. You're, like you said, you're basically, you're going to have many individuals who may be profoundly affected, but don't have the understanding of, their own kind of reaction to trauma, or they don't understand trauma at all, and therefore think, well, everyone here seems fine, this shouldn't bother me either. They move on. This, it accumulates, becomes worse. Whereas if you had somebody, what I think would be good for acute care professionals would be like a quarterly review for everybody. And it would be a one-on-one thing. It would be somebody's job, a trauma professional of some sort. And they would basically, it would be a wellness check. You see, it'd be a great opportunity to, you'd want somebody who had the ability to build trust. It would have to be a confidential, you'd have to get around the nonsense of, if they think the person's, you can't have somebody in there who's going to be rubber stamping every third person for as unfit to run their own affairs. You want somebody in there who cares about people and knows when an individual is not being protected or not, and is not aware of what's even happening to them.
Yeah.
So, I think if we could implement something like that, we would probably you'd have a lot less nurses quitting. You'd have less nurses using whatever substances to cope. I would love to see a pilot study on something like that. And maybe if I spent some time looking, maybe they do that in other countries like Europe. It sounds like something they'd be all over. But I don't know. What are your thoughts on that?
When I think about myself, how interesting it would have been if I was asked about my coping mechanisms and my general mental health, for one, obviously, but also to, over the course of a quarter of a year, if someone said, Corey, what were the top 3 or 4 impactful trauma incidents that you encountered? And depending on how I relayed them, I think it just would have been really interesting. Like, to me, as I reflect back, the incidences that were the most traumatic to me became etched in my memory, and I could remember every vivid detail of them, and I could recount them, like, second by second, and I remembered them way too vividly. And it wasn't until I went off work and was asked by the union, and then ultimately by workers' compensation, about what were the traumas that I encountered. And I remember I rattled off 10 of them just as an example, and I could have, I was being conservative, and they had the amount that they impacted me varied, but for the ones that were the most impactful, I remember them so well, and they were just right at the forefront of my memory, even months later, even years later. And so I think to check in with people and to see, like, what have people actually been through, because that was not a question that was asked of me. Those were stories that became, a healthcare notch in the belt, unfortunately, that, a war story that you would share maybe at the nursing desk on a night shift, like, I saw this and this happened. But they weren't necessarily like, how did that actually feel for you?
Yeah, it's really interesting that you describe those memories like that. I can't remember if you I don't know if you're aware, but apparently there's, when you have a traumatic event that impacts you in a significant way, your mind actually, there's a change in the hippocampus that can be, we can see it on a functional MRI.
Yeah.
Whereas those traumas are stored in parts of the memory that are different than normal memories, and they're much more robust. And that, what you're saying is, it seems to me that if I was trying to assess people with trauma and they were able to, rattle off 10 stories that were in great detail and were, about months ago or years ago, I would be very concerned immediately.
Yeah.
So, maybe it wouldn't be very hard to actually implement something like this, as far as just kind of like throwing up some flags, right? And asking those questions. Like you said, nobody ever asked, well, what do you think? You're like, man, that sounds pretty intense. Do you think that is affecting you somehow?
Yeah. Yeah. And also things that happen on night shifts can be overlooked. Things that happen on weekends when there isn't the management and support staff there. There's an impact there, or at least like those things can kind of fall by the wayside, and go unnoticed, say. And just because of the nature of the job, we don't necessarily stop and take an inventory of what we've been through. And I think if I could do something differently, I would have taken that inventory a long time ago, and obviously unpacked some of those things before it reached a crisis point, for sure.
Yeah. Yeah. So it's interesting because with nurses, it seems like, well, police, anybody who's frontline, it seems like the more potential there is for trauma on your job, the more weight is put on that individual to tough it out and not evaluate it. We're doing the exact opposite of what we should be doing for those individuals.
Yeah.
It's a bizarre thing. And then to, kind of scratch your head and wonder when you get nurses that are using drugs to cope or, get through a shift, or when you have RCMP who are going home and drinking themselves to sleep every night. It's not like we don't have the information. We have some pretty good information on how trauma works.
Yeah.
And I think it's time we really made adjustments to counter that kind of tough it out narrative. And I realize that this is not a new concept, but it isn't a concept that seems to be getting implemented very quickly. No, it's not. And we talked that a couple months ago in our podcast that they were talking about peer support meetings for professionals to log in online and kind of check in. But my understanding is that those are a little bit more general. So I think with trauma specifically, it has to be a bit more direct in the action that's taken. Yeah. And I think it's got to be in a setting that doesn't involve your peers for this one. You can't be going to it can't be a group thing where you all show up as you stated there in your debrief, because inevitably it could be the person who's only been on the job for 6 months and they're rattled, man. Like, if for whatever reason, maybe they'd experienced a similar trauma or whatever happened, they're rattled, but they're just trying to keep it together. They don't want to say anything because they're worried that they're going to get a negative report, or it's going to affect their employment somehow. We need to be able to get those individuals into a place where they can at least unload some of that stuff to somebody who's going to respect their privacy and give them some feedback that they can then go on to use.
Yeah.
You know?
Yeah. And there's obviously there's an implication for sick time. There's an implication for the staffing of these units or these hospitals or these police departments. But again, the impact is far greater when it's ignored.
Exactly.
Far greater when it's ignored.
Yeah. Yeah. I mean, anybody who says they don't have the money for that, I would challenge and say, look at how many healthcare professionals you're losing now. Look at the ones who are performing, a quarter of what they could be doing because they can't sleep because of whatever their psychological problems are that aren't being addressed, or they have substance abuse issues that are, they're drinking too much after the shift. They're showing up hungover. There's so many of these things that we know are going on, and I don't know what the actual number is, but I would imagine that if we took some precautions here, we would, in the long term, end up saving a lot of careers, probably save some lives along the way, and eventually you would save money.
Absolutely. And I was always, I always went away from the debriefs with a bit of a feeling like, from my employer's standpoint, I wondered if the employer thought like, okay, that's done. We're absolved of any responsibility, or we've done our part.
I see.
And it's bigger than that. I think it requires checking in and follow up. That debrief can impact how trauma sits within our brain, within our whole bodies, but it's not a complete prevention of PTSD and of its impact.
Yeah, well, clearly not. I mean, you were existing in a workplace that had that framework set up, and yet you had, well, we know people who have been terribly traumatized, and whether or not they go back to work, it's going to be a long road for them trying to get past how much trauma has accumulated in a really quite a short amount of time too. I mean, it doesn't take much if it's a direct hit and it's already somewhere that you're weakened from another experience. Yes.
Yeah.
Yeah.
And I really learned in counseling during early recovery that those memories that I kept coming back to in my mind, I was coming back to them a lot, and I wasn't even noticing how often I would come back to those memories. And not like flashes, not like the classic kind of what we think of as PTSD, where it's like this big, flash that wakes us up at night or that alarms us. But just over the course of a day, particularly when I was at work, where those memories would come into my mind being triggered by something else, where I would, see, for example, see blood, and another memory would come into my mind. Mm-hmm. Or see a certain type of patient, maybe see a child, and then I would think of another incident with another child. And I don't think at the time I fully recognized that as a warning sign, that those were things that were lingering, and that those were the things that I specifically needed to pick apart with a professional and talk about. And for me, I ended up doing art about it and kind of figuring out ways to release it. It was just like, I remember just brushing it off when I would be at work and have a flash of an incident that had happened, and then be like, and then kind of keep going. And not realizing that, what I learned through smart recovery, say that thought was leading to a feeling in my body, a feeling of a stress response or an anxiety response that I was then trying to cope with. And that's the link there, right? Like that's the whole bloody thing.
Yes. And as you were describing it there, I was wondering how many people would be capable of recognizing that if you just went around and picked a few people out of a hospital or out of community settings and asked them if they had those kind of thoughts. Could they remember certain incidents that seem to recur, those kind of things? What is the baseline level of awareness of trauma in the first place?
Yeah.
I would suspect that it's quite low. I mean, it's a lot more, it's a term that's used much more frequently these days, but to understand the psychological impact of it, and how you said, like how your thoughts play into your actions and emotions. I think if people were even operating on an awareness at that level that you're at now, where you can see that, maybe they'd be able to sort of regulate themselves out of those situations better. I don't know. But
I mean, that's probably a whole other chapter for us to talk about it, about, doing the assessment to find out the impact of trauma in the workplace on frontline workers, but then some actual coping skills and some actual like self-assessment.
Yeah. When you experience those event or memories at work, you mentioned that it made you feel anxious, and that there was maybe I think you're talking about like a cortisol type response where you get a little sympathetic nervous system action. Is it always the same kind of feeling? Is it a feeling that's unique to that process, or is there different emotions associated with different events?
Yeah, that's a great question. I think different emotions with different events. There were events that were scarier. There were events that were sadder and more painful, and events that were more chaotic and more anxiety producing and like adrenaline producing. So they kind of blur together, and one of those responses wasn't necessarily freestanding without the others. They oftentimes, there were multiple responses in one, but some had more than others for sure.
Yeah, I think back to situations that have caused me, whatever the event was, it caused a tremendous emotional response, and the memory of whatever events were taking place at that time. I mean, I don't know if it's etched into my head in the way that a traumatic event would be, but I do have memories that when I think about the memory and it replays in my head, I have a much larger than normal emotional response to the memory.
Yeah.
And I wonder if that's a clue as to how significant that event, I don't want to call it damage, or I don't know what you call it. Trauma, I guess. Yeah.
And the other thing that you just said that made me realize that you were talking about what was the emotional response to these situations I was encountering. I would have an internal response, but I was not outwardly emoting either.
Yeah.
And maybe there's a big part of the problem that when I think back on the stuff that I was seeing and encountering, any human being that was not desensitized would have been in tears or would have been distraught at some of the stuff. Like it is not normal to be a part of the death of an infant and not have an emotional response. For God's sakes, like I should have had an emotional response to that, but instead it was like all internalized. And I remember in that incident thinking, well, I can't cry right now. I can't break down. I gotta hold my shit together. And like that being pushed all the way down, and to the point where then if I was going to try to do that later on, or debrief it later on, or feel it later on, I think it would have been difficult. And I think the desensitizing had already happened before some of those big events occurred. So then when the event occurred, it was traumatic and I wouldn't outwardly feel it.
Right.
Or at least in a way that would be sort of normal within our society, say.
Yeah. So you're effectively training yourself via desensitization to not feel. And then when it gets to a point that you're starting to notice actual physical symptoms or psychosomatic symptoms, from this, the amount of trauma and toxic events that are building up, you not only don't have the tools to do something about it, but even when you finally go to find somebody to help you with that, they have to dig through 5 layers of armor because you've been training yourself for years to do that.
Yeah.
It's I don't know how our society, like I understand the logistics of what needs to be done in an emergency and everything, but I wonder sometimes if we're just asking too much of people. I don't know.
Because, do you want a doctor or a nurse or a police officer who's distraught and crying?
You can't have that.
No.
But we don't want people who are, we can't have those individuals go on to die of a heart attack or a stroke or drink themselves to death either.
No.
So there needs to be, our culture really fails here, but I know like other cultures, they have ways of, they have ceremonies and different methods and techniques and traditions where it allows them to maintain a certain state of mind in, say, battle or during the loss of a loved one, to respect their passing. And then afterwards, there's a process that they go through to bring all that stuff up and grieve the shit out of it, or feel it with the full force of your being. And somewhere along the line, we have lost that.
This is a great point there too. And, I'm aware that in palliative care settings, where there are multiple deaths on a palliative care unit a day, that there are those rituals.
Oh, really?
That are very much ingrained in the culture of the department, where the entire staff, say, would see a patient's body with their family, see the patient's body through to the elevator to take them down, where the same quilt that's sort of special and meaningful to the department is placed over that body, where there's a light in the department that is switched on for the day after an individual dies, say.
I see.
Things like that. So you think about that, and that's kind of fascinating and that's a slower paced, less sort of high intensity, high adrenaline environment. It's a much more gentle, empathetic.
It's a Western society version of, but at least it's something.
Yeah. And I would gather that the individuals who work there and get used to that experience and getting a sense of closure and having it be a meaningful, even you might say spiritual experience, that they have a different sense of closure than what in the acute or in the critical care setting is very sterile, and there isn't a lot of work to attach meaning or value to what has just happened. There's something to be said for that, I think.
Oh, yes. Yeah. When I think about a hospital, it's sterile. It's sterile, cold, reductionist. Everything's reductionist, right? Yeah. It's pieced out, parsed out. Everybody's got a job, position, everything. It's very mechanical. And it makes me think of books like Island by Huxley, where he basically describes what his idea of a utopia would be, and the amount of meaning and ritual that was, just a part of their everyday life, and how that impacted people's development. And they were never at any point fully detached from one another, never at any point detached from themselves. They were always kind of tuned in. And I know it's just a story, and it's kind of maybe a counterpoint to Brave New World or whatever, but I wonder about that sometimes, especially in our culture where we've kind of lost a lot of meaning in a lot of big events.
Mm-hmm. And I really wonder about that in hindsight, if some of those traditions or techniques that are used in a palliative care setting were used in the emergency department, if I would have felt differently at the end of the day, if I would have felt more resolved, or at least more derived more sort of meaning from the loss with the family, and felt sort of connected to it differently.
Yeah, it's hard because you're so pressed for time too, right?
Mm-hmm.
I mean, even if you had the time to contemplate what just happened for a second or two, there's so many areas here that could be improved.
Yeah.
But yeah, it's a fascinating topic, anyways.
Yeah, there's a reason why we have come back to it a number of times, and we will again, I'm sure.
Mm-hmm.